Superbugs refer to these microorganisms, and specifically we're talking about gram-negative bacteria here, that are resistant to most of the antimicrobial agents that we've had in our armamentarium in the past. And so obviously it makes it more difficult for us to treat these patients. It also threatens their outcomes because we know patients who have these multi-drug resistant pathogens, they tend to be in the hospital longer, obviously increased cost, and very importantly increased mortality. So we need to do what we can do to reduce that burden of disease. And the important thing is to know what our local antibiogram shows concerning the bacteria in each institution. And not only that, in the unit in our institution. One of the more common multi-drug resistant gram-negative pathogens that we see is Pseudomonas. And there's a variety of mechanisms by which Pseudomonas can be resistant to the antimicrobial agents, and they include reduction of ability of the antibiotic to get into the cell, or at least cross the outer portion of the cell, and we refer to that as reduced porin channels. Some bacteria can actually pump out the antibiotic so it doesn't have a chance to work. But the most common way is because bacteria can produce enzymes, and we refer to these as beta-lactamases when we're talking about beta-lactam antibiotics, that destroy or hydrolyze the antibiotic and therefore render it inactive. And we really have to look at each individual antimicrobial agent that's effective against the specific bacteria. Now, if we're talking about Pseudomonas, we need to know which antibiotics work the best against Pseudomonas in our institution, so that when we get a report from the laboratory, and now with the use of rapid diagnostics, we're getting these much sooner than we did before. So if we get a result that a patient has a significant infection and it's due to Pseudomonas, we want to choose the antibiotic that's going to have the best chance of covering that specific isolate for the patient's benefit. So we need to know what our local antibiogram is. Is the best choice for Pseudomonas in our institution? Is it an anti-Pseudomonal penicillin? Is it anti-Pseudomonal cephalosporin? Is it anti-Pseudomonal carbapenem? So that's the first thing I think we need to know, is how effective these specific agents are against a pathogen that may be multi-drug resistant.